Welcome back to Face the State. I'm Arianna Bennett. Thank you for keeping it here. Well, for most counties in Nevada, the new school year is just about here. A lot of parents might be thinking about back to school shopping, but you might want to add a trip to a vaccine clinic or possibly a dentist to the list. And my guest for this segment has an organization ready to help with all of that. So Megan Duggan with the Community Health Alliance is here to talk with me about all these things. Megan, thank you so much for coming on the show.
Thank you for having me.
Oh, it's my pleasure. My second Duggan of the month, which I feel very honored. It's like gotta catch them all, you know.
Right.
I had your husband on a couple weeks ago. He was awesome, but I do appreciate you taking the time as well.
You're welcome.
All right, so let's start with all this back to school fun stuff. You've got a lot going on right now. Vaccine clinics being one of them, so we'll start with those. Tell me what you're doing for that.
Yeah, so for the past few weeks, our team at Community Health Alliance has been extremely busy. We are partnering with the Washoe County School District to provide 10 different vaccine clinics at various schools throughout the community. Our pharmacists come to the schools and provide vaccines to the families for free, and it's such an incredible service. I believe we've vaccinated close to 950 students already, and we expect to see over 1,000, and that's almost, I think, about 1,200 vaccines that we've given in the mix, because you can get multiple. So it's just been an incredible journey, and we really appreciate the partnership with the school district to allow this service. It's incredibly important, especially for the teachers and the administrators of the schools, to make sure and catch the students who are needing those vaccines before the first day, so they don't have to turn kids away on the first day. That's really difficult. So it's a really big win that our team can be out there and supporting families in Washoe County.
Okay, so for families who still need to get this done, especially if it's not just Washoe County, some of the other counties start a little bit later. There's different locations happening around town?
Yeah, so various high schools and middle schools specifically. And then if you can't catch one of those clinics at the schools, you can come into any of our Community Health Alliance locations with a pharmacy, walk in and request those vaccines, or if you are a patient, you can book an appointment with your provider and also request those vaccines.
Okay, and then in terms of cost, how does that work? Are your parents paying? Is it free? Some of them maybe take insurance or not?
Yeah, so it's across the board. So if you are insured, most insurances cover the cost of vaccines. But if you are uninsured, we have incredible partners in the community that are covering the cost of the vaccines, including Molina Healthcare of Nevada, Silver Summit Health Plan, and Waste Management. They've all come together to support our community and those who are uninsured.
Okay, so that should not be a barrier to going and getting the vaccines your kids need.
Not at all.
Okay, now that's not all. You're also doing some mobile dental clinics for kids, and I know these are always really popular because dentistry is so expensive. So tell me about that initiative.
Okay, first off, so we have dentist offices at our Wells Avenue Health Center and our Sparks Health Center. Full-time, we're running full-time at Wells. A couple of days a week at our Sparks Health Center. We're just ramping up operations there again, and it's filling up really quickly. But with our mobile program, it's the 16-foot trailer that rides around Reno and Sparks. It's massive. You've probably seen it, but when you enter, you wouldn't know the difference that it's like a trailer versus an actual dental office. And what we do is we go to our health centers that don't have dental services on site to supplement the services that we don't have. So we go to our Sun Valley Health Center, we go to our Neal Road Health Center, and provide those services to new patients, to existing patients. It's available for anybody. Again, if you're uninsured, you're insured, you can access our services across the board, not just dental, but medical, and including the vaccine clinics as well.
Okay, so it's a good place to go, maybe get your kid the cleaning that they haven't had in a little while, get school started off on the right foot. Can they handle dental procedures there, or is it just for cleanings and assessments?
So yeah, procedures too. So cleanings, x-rays, cavity fillings, you name it, we can do it on the truck.
Wow.
Yeah.
That's so cool.
Yeah, it's amazing. It's beautiful.
And so for the schedule for that and the locations, is that all online?
Yeah, so folks can visit chanevada.org, and we have different tabs on the website to help you easily find that information. But you can also call 775-329-6300 to make appointments as well.
Okay, and now you mentioned that even if you can't make these specific things we're talking about, these kind of like going back to school things, as we head into fall and into the rest of the year, these offerings don't go away.
Right.
There are other ways to access them through just going to one of your health centers, or, and this is cool, I didn't know you did this, but the Wellness on Wheels service.
Yes. So Wellness on Wheels, our WIC team, which WIC is Women, Infants, and Children. It's a nutrition and breastfeeding program for moms with children under the ages of 5. But we, again, drive this vehicle 5 days a week to different locations and high need areas for those type of services. But it is a mint blue, you can't miss it, but it's Wellness on Wheels, and they provide all of those services on that truck, in addition to the services that we provide at our health centers. So all these efforts that we're doing is additional outreach efforts to make sure that we're meeting the community where they are. And that's so important in terms of access to healthcare.
Yeah, I mean, it's a really amazing service that you provide, and part of the reason that you're able to do that is because of your designation here as a federally qualified health center. Mm-hmm. Can you explain what that means and how it works?
Yeah, so federally qualified health center, also known as a FQHC, that really means that we are a healthcare organization that really focuses on comprehensive healthcare. We are not 100% federally funded, not even close, but with that designation comes some requirements around our governance and quality around our medical care. So for example, 51% of our board of directors need to be patients, and that's actually really incredible because they see it all. They experience the experience that all of our patients experience, whether it's good or bad, and they can report back to us, and that allows us to improve our operations. So that's incredible. On the quality side, we report to the federal government all our data, like demographics, quality improvements around diabetic patients, like are we moving the needle with some of these chronic diseases. And so with that designation, we're allowed to do a lot of different things, but I think the main thing that we can pride ourselves on is that FQHCs really focus on like the one-stop shop mentality. So we're not just providing primary care, we're also providing behavioral health. We're providing dental care. We have on-site pharmacies, we have prescription food pantries. We really try to tackle healthcare in a very holistic way, but also in a very convenient way. And that's what FQHCs are really, I think, that's what makes us special.
So how much of your funding is from the federal government?
It's a little less than 10%.
Oh, wow.
Mm-hmm.
So it's not as much as I expected. I thought it was going to be more than that.
Mm-hmm.
So that's including Medicaid and grants, or is that just the grant funding?
So we get a grant from HRSA, the Health and Human Services, oh gosh, I always forget the acronym, but the Health and Human Services Resource Administration. I think that was it. But we get that grant money based on the data that we submit every year and make sure that we are meeting those qualifications. From there, we apply for local and national grants. And then we are just like any other healthcare organization. Our biggest funding source is from insurance companies. So that's the Medicaid, Medicare, insurance companies, and so forth. And then because we are a nonprofit as well, we heavily focus on great relationships with foundations, corporations, individual donors. We have some really incredible supporters locally here to support what we're trying to do.
So you have a good diversity of
Yes.
funding then, which is important when we're talking about something like budget cuts on the federal level and cuts to Medicaid, both of which we've seen so far in this administration. How is that impacting you?
Yeah, that's a really great question. I think our biggest concern is the Medicaid bill that is being passed and it's going into effect in January of 2027. Our biggest concern is that 40% of our patients are on Medicaid, and to know that these requirements that they're passing in terms of eligibility and re-enrollment, people are going to lose their Medicaid coverage, and that's really disheartening for our patients who have to go through that. But we are concerned because when you lose insurance, you're most likely not going to seek preventative care. And so when you don't seek preventative care, those things become an emergency, and then you're going to the ER. And we all know that ER services are costly, the most costly, not just for the patient, but for our community. So I think that's what we're most concerned about. We have not felt that impact yet, because that is going to affect in 2027. But I guess I will say this, I personally have been at Community Health Alliance for 5 years, and we've been through various policy changes. We've been through the pandemic, and our team always comes out stronger than ever before. We have a great team, an incredible CEO who really understands the local, the state, and the federal healthcare policies, and brings that back to our team to make sure that we are doing what we're supposed to be doing in terms of our mission and providing quality health care. So when 2027 does hit and the Medicaid changes do happen, we'll listen and adapt and be stronger for not just our employees and our patients, but for the entire community.
Is there any plan right now to make changes to programming or staffing or anything like that?
No changes as of right now.
Okay, so the hope is to be able to weather the storm without.
Yes.
Okay, so then in terms of fundraising, I know as a nonprofit that you're always doing that. So do you need help from the community?
Yes, we always need support from the community. Again, we're a nonprofit and we couldn't exist without the support of our community. Just to give a stat to you, but in 2019, right before I started, we were seeing about 19,000 patients. As of today, we are serving nearly 34,000 patients, and that would not be possible without the support of our funders. And that allows us to expand services. We started a maternal health program recently. It allows us to expand our healthcare buildings. So capital campaigns have been a really big thing for us. Just a mini timeline for you. It's kind of crazy how fast things are moving. But in 2020, we opened our North Valleys Health Center. In 2021, we expanded our Sparks Health Center to include additional services and new providers. In 2022, oh my goodness, it's a lot, but we relocated and expanded our Sun Valley Health Center that was in much need. And today we are expanding our Neal Road Health Center, and we're close to our fundraising goal. We're about $500,000 away from meeting that goal. But it's an incredible partnership with the city of Reno. And we're expanding the building that they own, and so we can provide four new providers, which includes medical and behavioral health. We're going to add an on-site pharmacy, an on-site prescription food pantry. And so in terms of funding needs, there's always capital campaigns. We just had an incredible fundraiser last weekend. I hope a lot of people had so much fun. But we're always looking for support. In addition, this is something future thinking, but we just recently announced that we purchased our Wells campus. A lot of people know us for our Wells Avenue Health Center. I call it the mothership of CHA. It's our largest on Wells. But because of the support that we received from the state and the Pennington Foundation, we were able to purchase that. And with that purchase, we're able to create something really beautiful and create kind of a campus environment feel. Yeah. And expand services and maybe bring some specialty care of some sorts. So when that comes about, oh my goodness, we will always need support around that.
All right. Yeah. Well, okay. Then for if people want to help you or just get information about getting care to find out if you are offering maybe the kind of care they need, one more time, where do they go?
Yes, so they can go to chanevada.org or they can call 775-329-6300.
Okay, Megan, we are out of time, but thank you so much. I really appreciate it.
You're welcome.
Well, that is it for this episode of Face the State, but for more information or to see past episodes, you can head to our website, that's 2news.com. Thank you so much for being with us. We'll see you next week.